Okay, so first of all, I've had my upper eyes done and my lower eyes, and I've also had a breast augmentation to enhance my breast. The reason why I chose the Manchester private hospital is because they'd recommended, the staff were very friendly. I also did a little bit of research on Mr. Singh, my surgeon, and I looked at his before and after photographs, and I really liked the results that I saw. So it really showed me that this was the place that I wanted to come to. When I came for the consultation, I found it very relaxing, reassured. I got all my questions answered, and it just went on from there, really, from booking, the friendliness, and of course, you know, the nurses all the time keeping on top of things, phoning me up and giving me updates on when to come in, what time, what to bring, because you do forget these things, and it was so nice to be reminded. The consultation with Mr. Singh was basically seeing first of all if I needed it doing, then talking me through what I should expect, and also, you know, how long I was going to go into theatre, how I was going to be afterwards, what was my downtime, you know, how long was I going to need off work. And obviously I have to fit this in with my lifestyle as well, because obviously I had holidays booked with work, time off. So he gave me all this information. Also, what to do afterwards, you know, what I'll be doing when I come back, and what the recovery time is like. So when I looked in the mirror, and of course getting to my age now as well, as the eyes started drooping down, it was just better for putting makeup on. I felt more awake when I looked in the mirror. I didn't feel as tired. So I think that was a massive thing, because you can't cover your face up. You know, you look at your face all the time. And then, of course, the breast augmentation for me was definitely the best as well, because when you look in clothes, on holiday, you know, and it's just making you feel so much more comfortable and confident on the way you look with your body as well. And especially when you've had children, it's just getting more fuller breasts. So when I got up, obviously, the night before, I knew when to not eat, because obviously Katie, the nurse, had contacted me and told me when not to eat. So what I actually did was, after 9 o'clock at night, I went to bed and didn't eat anything or drink anything again. I got, actually, my daughter brought me, and so she dropped me off, and when I went then taken into the ward, there was Katie. She gave me the rundown on what to expect. The anaesthetist came to see me, and of course the lovely Mr. Singh. Now, of course, when the anaesthetist came to see me, it's a bit of a buzz, because I love general anaesthetic, so I don't really listen to what he's saying. I just think I'm going to be asleep when all this is happening. So just the excitement of that in itself. And then, of course, my lovely surgeon, Mr. Singh, he came in, he marked me up, went through again very briefly what he was going to do, marked my eyes up, and all my body. And the feeling was actually excitement. I wasn't nervous at any point, not even coming down. It was just the fact that I'd waited so long to get this done, that I just wanted to get it done over and done with. It was just, let's get to the next stage now. Get me in that operation table and let me get healed. That was the main thing. So, of course, after speaking to Mr. Singh and him marking me up, the nurses took me down to the theatre. And it was just so comforting. They was like, you know, you're going to be all right, Lorraine. We're going to hold your hands. Of course, they didn't realise how much I love anaesthetic. So I was just like, it's not a problem. And then I was just lay on the bed. And before I knew it, it was 10:09 and I was out. And when I woke up with my breast done. And my eyes done. And I can honestly say I wasn't in any kind of discomfort at all. But I'll be honest, the next thing I wanted to do was get home. That's my nature. I just wanted to get out of here and get home. And within probably about 40 minutes, I was sitting up having a drink of coffee, which the nurses brought to me, and a sandwich as well, something to eat. Went to the toilet, saw Mr. Singh again. He had a look of, obviously, the work that he'd just done, and just basically gave me the instructions to take it easy, don't overdo it, go straight to bed, and basically just chill for about a week. You know, and put plenty of ice, obviously, on my eyes, keep the swelling down. And that was it, really. After my daughter came, we went home, and that night I just slept, literally. But I slept with my head slightly back, but I was more conscious about it. But of course, that was only for about 3 days after the operation. And then you wake up and you're on the side, not meaning to, of course, but I wasn't in any kind of pain. I think I actually took painkillers for the first 24 hours and that was it, which was actually a paracetamol. So I found it absolutely, I just healed so quickly. It was lovely the next day. Marie gave me a call just to make sure I was okay, and also just to touch base with me to make sure I got all my appointments, because obviously I had to come back and have my stitches removed, and they usually say it was 7 to 10 days. So I had an appointment booked to come back to have my stitches taken out, which I couldn't wait for, because at first I thought there was the swelling of the eyes and the bruising. We can't even think about removing these stitches yet. But then, of course, the next day I looked again and the swelling started to go down. The bruising was going as well. I'll be honest, after 4 days, I didn't have any bruising. I went and walked the dog. I got my sunglasses on and I walked the dog. So, but of course then when I got my appointment to come back, my daughter brought me back, and then of course the nurse removed the stitches. It didn't hurt. It was a little bit of a weird feeling, but it wasn't very painful at all, and I just couldn't wait to see. It was slightly red, but at this point the majority of my swelling had gone down, all my bruising had gone. And I knew the next stage then I could put makeup on, which I put my makeup on after 12 days and it looked fantastic. And it was like a matter of, I could see my eyes, my bottom lids again, whereas before I couldn't really see them. So it was totally different putting the eyeshadow on. And of course, putting the clothes on for work, it looked totally different because obviously now I had more of a fuller breast. So, of course, after the sutures, my stitches had been removed, I got an appointment then made to see, obviously, Mr. Singh. Mr. Singh's was an appointment for my checkup, and that was after 6 weeks. So I came back to see Mr. Singh. Of course, it was all ongoing with the coordinator phoning me up just to make sure how I was feeling. But of course, I was absolutely great. I was in no pain at all, no discomfort, and I felt really good about everything. I went to see Mr. Singh after the 6 weeks, and of course, he was very pleased with his work. I still had some slight swelling in the eyes, but nothing that anyone would really notice. It was just the surgeon would notice slightly, probably more on one than the other, which again is very normal. Because as he's saying is, you know, they're not twins, they're sisters, like your breast and like your eyes, which is quite a good saying. So I knew exactly where he was coming from. And I just felt really great. So after that checkup then, you get your next checkup obviously in 6 months, which obviously I've not had yet because it's not 6 months on. So in that, you know, I've got a really good result, really pleased with it. And it's just a case of it just gets better and better, because obviously now majority of my swelling's gone down in my breast, and all the swelling nearly has gone down in my eyes. But you just have to give it that 6 to 12 months. I would advise anyone that's thinking about doing it is just to make sure that it's for them and not for anybody else. If it's something that bothers them, then it's the right thing to do. If it doesn't bother you, it's not the right thing to do. But if you're really bothered and you want your eyes doing, or you want your breasts doing, or anything that you don't like, that you're constantly thinking about daily when you look in the mirror, you're conscious on what you're wearing, then it's the right thing to do. Then just do your research. Work out when you want to do it, when's the best time for you when you've not got holidays booked, and do your research on your surgeons. I always say go with your gut feeling. If you feel relaxed in the environment that you're in, with the girl that takes your information, even from the receptionist, then down to the surgeon itself, you've got to tick all the boxes. And once you know yourself, if the surgeon understands exactly what you want, I think then you know you're with the right person. Right, since having the operation done, it's made me feel a lot better, more confident with myself. In other words, when I'm going out for dinner and I'm in an environment where I've got those young people around, I don't feel as old. Also, as well as I feel more comfortable when I go, you know, for going away, wearing bikinis and wearing certain outfits, whereas when I had them on before, I felt very conscious of my breasts. I felt very conscious of the way I was looking. I didn't want to, you know, I wanted to really cover up because I didn't have any fullness or volume there. Whereas now I feel very confident and I feel better. When I'm going shopping now and trying clothes on, I feel better. It's not a case of me putting it back on the rack, but going to purchase it because I feel good in it. Okay, the best benefit for me is, you know, I just wanted that fullness back. I wanted to feel more more me again after obviously having children, and that's what I've achieved. So now they stand where they should do instead of going a little bit lower where they shouldn't be. So that for me is what's made me feel so much better, and that's what I've achieved.